Engrossed in a game with his brother Ben Clark on the left, can shoot down spaceships, and there's something else he can do. He's still able to walk. At the age of nearly 12, that is not a given for a boy with Duchenne. A form of muscular dystrophy, Duchenne causes progressive muscle degeneration and weakness.
So Ben is a little bit of an outlier because he is still ambulant and still able to walk. And I think that is why access to this drug is so important for us as a family and for Ben and his quality of life.
The drug Alex Clark is talking about is Givinostat, the first to show a slowing down of that degeneration, to give boys, and it is mainly boys, longer, literally on their feet. Across England, though, hospitals are either delaying or are refusing to give the new treatment. In Ben's case, Oxford University Hospitals has told families that despite the drug itself being provided free, they cannot afford to treat their patients.
I see my son, his body composition, his ability changes daily. He is getting weaker. And if we don't get this drug to boys like Ben and to Ben, the trust is going to have it sitting at their feet, a whole lot of non-ambulant boys, a whole lot of boys in wheelchairs.
In December, the Medicines and Healthcare Products Regulatory Agency, the MHRA, approved Givinostat, and the drug company said it would provide it free. Hospitals were asked to administer it under an early access program until the National Institute for Health and Care Excellence, or NICE, can evaluate it for approval. That's expected to begin in September. But it took until March this year for the first trust to agree. That was the Leicester Royal Infirmary, followed by Cardiff and Swansea. Now Great Ormond Street Hospital has said that they will start to provide the treatment for Duchenne boys from next week, and Scotland is following suit. But Gosh told me that it has been a challenge with the resources in the NHS more stretched than ever, and they said they were working hard to find the funding. It has become a postcode lottery. Just south of here, the Evelina Children's Hospital has told parents maybe sometime in the summer, while other trusts haven't even gone that far. Duchenne UK has met with the Health Secretary to discuss this, but the department says it is up to individual trusts.
We, Duchenne UK, have invested millions of pounds in building an infrastructure to run clinical trials, and Givinostat was one of those drugs that was run through that clinical trial infrastructure. Now it's been approved by the MHRA, and the hospitals can't deliver it to patients, and this is absolutely heartbreaking. You know, there's one thing worse than having no treatment for your disease, and that is knowing that there is a treatment that has been approved as safe and effective, but you can't access it because the NHS trusts say they don't have the funds to deliver it. This is a free medicine. It's 2 spoonfuls of medicine a day and some blood tests.
It is all about the money. Under the early access programme, trusts have to pay out of their own budgets for the administration and monitoring. And Channel 4 News has now seen internal emails from the Oxford Trust. Its medical officer writes, "Unfortunately, however, given the current financial climate and the expectation to make significant savings, we are not in a position to fund services, treatments that are not nationally approved without stopping doing something else." The Chief Finance Officer responded saying, "It's not our job to fund new medicines that are not NICE approved."
It is unfair that I don't live closer to London and not a gosh, or don't live in Leicester and I get access there, or we didn't move to Scotland and I would have access in Scotland. It's unfair that I live in South Oxfordshire and I can't get it because John Radcliffe Hospital have said no.
In a statement, the Trust said, "It's a measure of the importance we place on Givinostat that we have been working on a business case before the drug has been approved by NICE. We will continue working towards being able to offer the treatment once approved by NICE, as we hope it will be."
We've looked at the business case of OUH, and I've been engaged with the Hospital Trust for many months now. And we've been pushing for a figure. They've said it comes down to £66,000, and that's the cost of getting this drug in the hands of all of the patients that need it in Oxfordshire. Now that seems like something we as a society should be able to afford. £66,000 to extend the lives of young boys.
In the Duchenne community, they say time is muscle, and it's already 6 months since the families were told there was a new drug. Now that time is slipping away.